Hi winners, this is Dr. Srikanth from Team MDS CONQUER. Now I'm here to discuss dental anatomy within 30 minutes. So the first important content is trite. Trites are of different types. One is set, second one is arch, third one is class, and fourth one is type. Set is different sets of dentition, that is the permanent and the deciduous. And arch, that is different arches, maxillary arch, mandibular arch, and different classes, that is the incisors, canines, premolars, and molars. Whereas coming to the different type, that is different types of teeth, that is the centrals. Okay, so incisors, you'll have centrals and laterals. Premolars, you have first and second premolars. Molars, you have first, second, and third molars. And I hope you are well familiar with this two words, that is succedaneous teeth and non-succedaneous teeth. So please do make a note of this. Next one is tooth identification systems. There are three types of systems which are very, very important and most commonly asked. And please make a note of it. Okay, universal system is given by, advocated by, and it starts from number 1 to 32. So it starts from 1. So this is 1. The 1 is the upper right third molar, and then goes to 16. And starts from 17. 17 is lower left, and followed by 32. So this is the universal system for the anterior, for the primary teeth. Okay, it starts from A and J and K to T. And the next goes is, we are well familiar with it, so we have discussed this. Okay, that is the universal system. The next one is the palmar system, where you can keep upper right, upper left, lower right, and lower left. Okay, so if it is in a deciduous teeth, it will be A to E. So this is the palmar system, 1 to 8, 1 to 8, 1 to 8, 1 to 8. The next goes is the internal system. Okay, internal system has 2 digits. The first digit represents the dentition arch in the side. Okay, so you can see 1, 1, 2, 1, 2, 1, 3. So it goes to up to 8. 2, 1 to 2, 8. 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 8. 4, 1, 4, 2, 4, 3, 4, 4, 4, 8. And this is one more system in the last video I was talking about. Okay, the system is also called as a European numbering system, which was still in practice in one country, that is Denmark. So positive and negative symbols represents the upper and lower arch. So upper arch are denoted by positive, lower arch are denoted by the negative. And coming to that of, the symbol was placed towards the midline. Okay, so you can see plus here placed towards the midline, and plus here placed towards the midline. So this is the difference. This is the difference. Okay, you can make a note of this particular system. So these are the different particular systems. Okay, I have given all the 4 systems I have discussed. So this is the numerical. This is the number based question. So they can give you the number of a particular dentition. Okay, for example 6-1, that is the deciduous dentition in one system. How it is corresponding to other system, they can ask you. Okay, that is central incisor, right? So these are the central incisors. So they can ask you corresponding. So anatomical crown versus clinical crown. So anatomical crown is something that is covered by enamel. Means you can see this anatomical crown up to the cemento-enamel junction. Okay, because this all area will be filled by cementa, right? So it will be seen only up to the surface where the enamel is covered. So it is seen up to the cement enamel junction, where the clinical crown is the crown that is exposed to the oral cavity. So in the case of gingival recession, like in this particular case, you will have more clinical crown when compared to the anatomical crown. In the case of gingival inflammation, you will have more. You will have anatomical crown will be more, because most amount of the crown will be covered by the gingiva. So what is seen clinically is clinical crown. Clinical crown will be less in the case of gingival inflammations, and clinical crown will be more in the case of gingival recession. So this is again a most commonly asked question. Okay, so you can make a note if you're not good at this. A is haplodont. B is, you can see 3 cusps, that is trichodont. C is the arrangement of cusps, that is tubercular molar, and D is tetra, you can see quadri tubercular molar. And of course, you have questions on this in almost all the examinations. So triangular shape at the anterior 6 teeth, that is the mesial and the distal sides. And trapezoid, the longest uneven surface towards occlusion of the incisal edges, is seen in the case of an anterior labial and lingual surfaces and posterior buccal and lingual. And trapezoid with the shortest is facing towards the maxillary posterior, mesial and the distal. And rhomboidal are present in the case of a mandibular posterior, mesial and distal. So please do make a note. They can ask diagram based question, or they can directly ask you which of the following is triangular, trapezoid, upward short, upward long, upward short. Of course, okay, every year, like if you see from 2017 questions are there, 18 questions are there, 19 questions are there, 2020 lengthy paper, even questions are there on this particular. And most important thing that you have to make a note is the eruption numbers. Eruption numbers are most commonly asked. Sometimes they can ask you at birth. Please do make a note of this, at birth. Okay, so root completion. Okay, root completion of all the teeth will be completed by 16 years. Okay, by 16 years all the teeth are completed except the third molars. Of course, anterior teeth, because they can ask you apexification, apexogenesis questions. So all the anterior teeth will be done by 10 to 11 years. You can see this is 9, 10, this is 10, 11. So by 11 years, all are completed. So if they're giving in a question, a boy of age 9 years or 8 years, means root is not completed. Then you have to check the vitality of the teeth. If the teeth is vital, you have to go for apexogenesis. If the teeth is non-vital, you have to go for either apexification or either you have to go for revascularization. Okay, I hope you are very clear with that particular concepts which we have discussed a number of times. But make a note, these eruption numbers are very, very important. So eruption numbers for all the teeth are very important, nothing to be missed. And root completion of at least anterior teeth are important. Okay, initial evidence, okay, that is more than sufficient. Okay, so please do work on this, very, very important. Of course, we have questions on in the INICET, in the AIMS, in the last year AIMS, and of course in the NEET too. And I hope you are very, very familiar with this terminal plane relationship. They can ask you. And this is cervical enamel projection, that is the apical extension of the coronal enamel. So normally your enamel will end at cement enamel junction. Sometimes some sort of enamel can extend onto that area, that is called as cervical enamel projections. They can ask you question on this classification. This is once asked in PGI. So cervical enamel projections are categorized into grade 1, grade 2 and grade 3. Please go through. Okay, it's clearly grade 1, grade 2, grade 3. It's clearly there. Just go through this table once again. Okay, of course you know the line angles and point angles. So logically, if they give any sort of class, you can imagine and just list out the number of line angles and point angles, or else sometimes they can give the names of line angles and point angles. Okay, line angles will have 2 sides in its name and point angles will have 3 sides in its name, by which you can differentiate. Imagine the diagram of the cavity, and by which you can know the number of line angles and point angles and the names of line angles and point angles also. So coming to the class 1, so class 1 and class 5 will have the same, that is 8, 4, 8, 4. Okay, and coming to the class 2 and class 4 will have the same, that is 11, 6, 11, 6. And class 3 is 6, 3. They can ask you embody. Embody is 14, 8. The next comes the angulations and inclinations of the teeth. Okay, so we have discussed so much regarding this. What is the highest, what is the lowest, or what is the highest in the anterior, what is the highest in the posterior, what is the lowest in the anterior, what is the lowest in the posterior, the regularly asked questions. So one side we are talking about the mesodistal, on the other side you are talking about the facialingual. So facialingual is the one side and the mesodistal is the other side. Please do make a note of these. Values are not important according to me, okay, but highest and lowest are important. So I mean, like 0 sounds to be catchy. Okay, so this is the only one which is having a 0 value, and the maximum value is, of course, I think it's 28. Okay, so please do work on this. We have many classes on this, and you have good synopsis on this. Please do work on this. And I hope you know the number of lobes. Okay, primary incisor, it is 1 lobe. The minimum is 1 lobe. Okay, so the maximum is 5 lobes. Okay, so please do make a note of this, very familiar one. And of course, until now we are talking about the permanent teeth. Now it is primary teeth. So please do make a note of the primary dentition eruptions and primary dentition initial calcification. The first one is 14th week. Most familiar question, right? Most familiar question is the 14th week. Root completion of all the primary teeth is done by 3 years. And of course, okay, not seen much questions regarding the lengths and all this, but they can ask you highest and lowest. I hope you are very familiar because we have a table in the Dental Pulse, we have a table in your PP books and everywhere. But I'm really stressing and specifying it again. Highest and lowest of all these are very, very important. If you're not clear, just go back and just have a glance, because this is completely Raleigh memory based. And few terms and terminologies nowadays, they're asking a very decent questions on dental anatomy, because dental anatomy and dental histology together, according to the NEET blueprint, is going to be 14. So it's going to be 7. They have to give 7 marks from anatomy, and of course they are giving definitions too. Or nowadays we have like 40-45 plus diagram based questions. They can give a simple diagram by marking the landmark. Okay, slopes of cusps are also called as ridges. What are they? Please do. What is cingulum? Definition and followed by the marking. Next one is labial ridge, very specific to canines, that to maxillary canines. Cervical ridge, marginal ridge. I hope you're very familiar with all these terms, but I want you to be more clear, because they can give a shade at this particular area and they can ask you the shaded area represents which. Triangular ridge. What is the difference between triangular ridge and transverse ridge is a question asked in 2018. Hope this is a question like how many number means it's going to be 3. This is sulcus. These are the developmental grooves. These are the supplementary grooves. This is a fossa. These are the pits. This is a furcation, and of course I hope you're well familiar with the root trunk. Okay, the values of the root trunk are also important. How it will be on one side, mesial side, distal side, and the palatal side. There are many such numbers in your dental or not. Please do make a note of that. Permanent maxillary canine and the permanent mandibular canine differs in. Okay, so question is given in 2018 NEET. So please do check this. These are areas of interest for so many paper setters. Please do check this. I hope you know the oblique ridge. Oblique ridge was a question that is given in 2018, 2019 too. And I hope this is a smile designing concept that is called as a golden proportion. I mean, if they ask the ratios are going to be 1:6:1:1:0.6. So see what they're asking, like whether they're asking the central to lateral or lateral to canine or lateral to central. So basing upon this, the value is going to change. Okay, it's going to be 62%. The concept says the 62%. The mesodistal dimension of central incisor, the mesodistal dimension of lateral incisor is 62% of central incisor. The mesodistal dimension of canine is 62% of the lateral. This is basically what you see from the frontal side, like from the midline view. If you see this is how much the tooth structure that is going to see. This is called as golden proportion. Make a note, guys. Spend 2 to 3 minutes, nothing wrong. Okay, all the smile designing concepts, everything. Okay, there are different rules, including golden proportion. There are many 2 to 3 or 3 to 4 rules which are recently shared on the group, and I want you to just have a glance over that particular area, because smile designing is something not new, but something which came into practice. Now that many people are practicing, and of course NEET will focus on such areas. So please do have a look. And of course this question was given in 2018, 2019. Okay, many times, many exams. The teeth which has, apart from the third molars, the other teeth which has maximum number of occlusal variations is the mandibular second premolar. Hope you are familiar with the cusp of Spee. Hope you are familiar with the cusp of Wilson. Diagram based, I'm main focusing on diagram based stuff. and please do go through this. Okay, so this is the difference between the primary and permanent dentition, and of course this is a well versed important area. Okay, your enamel rods, how they're oriented in the primary and permanent dentition. Okay, so please try to focus on dental anatomy is an important area of memory based, stressing memory based. Okay, very less number of logical based questions will be there in this area, so it's more memory based, and of course it has to be revised in the last 5 days at any cost. Done for now. Signing off, Dr. Srikanth from team MDS Conquer.